David Drew Pinsky, commonly known as Dr. Drew, an American media personality, internist, and addiction medicine specialist who hosted Celebrity Rehab with Dr. Drew, has completely turned into an anti-vaxxer. Allegedly, this occurred back in February and March of 2020, where he made a series of statements concerning the COVID-19 outbreak, where he downplayed the seriousness of the pandemic, stating that it was not as bad as the flu, and suggested that it was a press-induced panic. He apologized in April 2020, and then he urged people to follow the advice of Anthony Fauci. Despite this, however, he continues to publicly endorse anti-vaccine and COVID minimizing theories. And he especially does this on his YouTube channel. He has a lot of people on there that he interviews that are anti-vax and that downplay the COVID-19 pandemic. Most recently, he has had 2 videos removed from YouTube for spreading medical misinformation.
Karma's a bitch.
Queen of Karma.
He posted this to his Twitter, complaining that YouTube was trying to censor him. He states, "This weekend, YouTube creators accused me of spreading medical misinformation and took down 2 videos with an MD and a lawyer. I've been a board-certified physician for over 40 years, 2 times YouTube's existence." So let's take a closer look at the timestamps they say are quote-unquote harmful. He posts proof that a video has been removed for violating YouTube's community guidelines. However, it looks like he didn't get a strike and that the content was just removed, and they're telling him that he got a warning. He has to take a policy training course in YouTube's back studio in order to continue. He goes on to say, violation 1, medical misinformation at 22:52. Dr. Kelly Victory shares her professional opinion about young people who were injured by mRNA side effects, saying the vast majority of the people who have been injured are young, healthy people who were under the age of 50 who had fundamentally zero risk from COVID itself. They all got COVID. 98% of the population has documentation they've had COVID. These are people who would have been fine if they were just left alone. Again, that's quite the statement. The 2 people on screen at Dr. Kelly Victory and me are licensed board-certified physicians who completed medical school decades ago. That doesn't mean anything to me because we know that multi-level marketing companies hire doctors to say that their products are safe in order to make money, even though the products are proven to be harmful for people. So doctors grift in the anti-vax community all the time because they know that they'll make a lot of money and get a lot of attention as like the token doctor. Oh, look, we're right. We have doctors on our side, right? They legitimize the conspiracy theory. Similarly to how doctors and lawyers and etc. legitimize cults and scams. He says, I was chief resident at Huntington Hospital, an assistant clinical professor in medicine and psychiatry at Keck USC, and a director of addiction services at Las Encinas Hospital for 25 years. Congratulations. Do I agree with everything Dr. Victory says? I do not, and she wouldn't hesitate to say the same about me, often on my own show. But I have a commitment to free speech and open debate between dissenting experts. It's not medical misinformation for a licensed doctor to provide an opinion on a broadcast. Here's the thing. If you're going to put her license and the fact she's a licensed doctor in her face, then what she is saying is then not an opinion. It is the medical advice of a licensed professional. You cannot say, listen to me, I'm an expert in this field. Oh, but this is only my opinion. That's not how that works. And it's almost like Dr. Drew doesn't get that.
And the real tragedy with this, Drew, is that the vast majority of the people who've been injured are young, healthy people, people who were under the age of 50, who had fundamentally zero risk from COVID itself. They all got COVID. 96%, 98% of the population has documented and well known that they had COVID, okay? These are people who would have done fine if they'd just been left alone.
See, the thing is, she can't make the statement that they wouldn't have gotten COVID without the vaccine because they're not her patients. She knows nothing about them. She provides no evidence of anything she's saying. And therefore, it is considered medical misinformation. As YouTube explains here, content that possesses a serious risk of egregious harm by spreading medical misinformation about currently administered vaccines that are approved and confirmed to be safe and effective by local health authorities and the World Health Organization isn't allowed on YouTube. And she's very clearly stating, don't get the vaccine or else you will end up with COVID. Like she's blaming the vaccine for the COVID. And that information has been disproven that's a thing because there's not even a live virus in the COVID vaccine. So like that doesn't make any sense medically. So if you're going to flash your license and her license at us, can she at least use it? Don't you take some kind of Hippocratic oath to not do harm? What happened to that? He goes on to say, by the way, here is Dr. Fauci in 2023 insisting there's no doubt that masks work, despite the data and opposition from public health experts like epidemiologist Dr. Harvey Risch, a Yale professor who told me, in reality, what you're talking about is putting up a chain link fence and hoping that it blocks mosquitoes. Dr. Fauci's interview is still fully available on YouTube. Yeah, masks don't work. That's why doctors and nurses wear them in the hospital while they're dealing with sick patients. Because they've never worked, it's just useless. They just think it's pretty on their faces. There's no evidence that back up that they work. Like this is what I mean. Even this is misinformation. Violation 2, medical misinformation at 3821. Attorney Warner Mendenhall of Akron Law Firm shares his professional opinion and details about a case he's fighting. And I guess this is a quote from him. I believe about 500,000 people have died from taking the shot. Okay, you believe or you have the evidence that support that and that's why they passed away. See, this is the thing about medical misinformation is that if you don't have evidence of this and you state it as a medical fact, it's medical misinformation. We are currently representing one of my clients who is extremely ill. Her spinal cord has been damaged. She's having trouble breathing. She goes by the coerced nurse. Now, you don't say. Do I agree with everything Mendenhall says? I do not. I haven't seen convincing evidence that 500,000 people died from the shot. Then why, I haven't seen any evidence that this has happened. And I don't know why they're saying that we're spreading misinformation by having people on my show saying it did happen. It's crazy weird. But it is not medical misinformation for an attorney to discuss the details of an ongoing case. See, that's not what they got him in trouble for. They got him in trouble for the specific comment that he made about how apparently 500,000 people died from the shot when it's not true. Hello, Dr. Drew, anything in that brain left? Even if those details do not align with the CDC's preferred narrative at the time. Example, the Tuskegee study, Guatemalan STD experiments, Willowbrook hepatitis study, Camp Lejeune water contamination. It is not medical misinformation for someone to state their belief that a large number of people were harmed by a medical product or study. It is, because that belief is wrong, and spreading it as factual should be considered misinformation. That is his opinion based on evidence from his cases. But he hasn't had 500,000 cases that have proven that. He hasn't provided us the data that that is a thing. You even state you haven't seen any convincing evidence that it's true. So how do you not understand that that's misinformation being spread? And again, you want to talk about how he's an attorney. Therefore, he's an expert on this, but then you just want to call it his opinion. Pick a lane. It can't be both. You're either just sharing your opinions as just a normal person in society who has opinions, or you're giving your expert opinion or your expertise. Like, it can't be both. It's medical misinformation according to YouTube for the same reason the last one was.
That's a lady named Danny Baker, by the way. She goes by Course Nurse on Twitter, and she's a fantastic client to have, and we're going to try to make a point with that. I believe about 500,000 people have died from taking the shot. We're currently representing people. One of my clients, unfortunately, is extremely ill. Her spinal cord has been damaged. Her diaphragm no longer works properly. She's having trouble breathing, and she's 40 years old. And she took it because of her job. That's a lady named Danny Baker, by the way. She goes by Course Nurse on Twitter, and she's a fantastic client to have, and we're going to try to make a point with that.
And just because you have one client that might have that experience doesn't mean you can go stating that 500,000 people must have the same one. By the way, here's Rachel Maddow telling MSNBC viewers, we know that the vaccines work well enough that the virus stops with every vaccinated person. A vaccinated person gets exposed to the virus. The virus does not infect them. The virus cannot then use that person to go anywhere else. It cannot use a vaccinated person or a host to get more people. It stops the person from being a carrier and making it contagious, is what it sounds like she's explaining. Then he says, how do I get these warnings removed? It's simple. I must attend YouTube's re-education training and be a good boy for 90 days, or else they will delete my channel and its 1,000 plus videos. So as you can see, it's a training about medical misinformation. Obviously, he does need to take it again. It will teach him about preventative misinformation and treatment misinformation and denial misinformation, which is what he's guilty of. He goes on to say, these aren't the first warnings or strikes I've received from YouTube. So again, you're a repeat offender. You're lucky you just got a warning. The first time this happened, my producer got on the phone with them and made peace. It's hard to moderate billions of hours of content, and YouTube will make mistakes sometimes. But when it happened again last year, my producer politely asked them if I could do a provider-to-provider call from one physician to another so I could have a clinical conversation with the person on their side who is judging my interviews. Dude, it's usually a bot. Like, are you kidding me? But you think that somebody at YouTube is hired just to look over your content and then see if you're like, Lord. The hallowed YouTube moderator who graduated medical school, spent time in residency, and treated enough patients to confidently claim my professional opinion is harmful enough to justify censorship. Again, you want it to be seen as your professional opinion and your friends' professional opinion, but then you want it to be taken as just an opinion and not medical misinformation. Make it make sense. And just because you have doctor in your name and you went to school to be a doctor doesn't mean that you can then sit on a public platform, which is owned by a private company, by the way. Therefore, they get to choose the rules and they can kick off anyone they want and spread like any kind of medical information that you choose. And then go, oh, well, I'm a doctor. I know more than the people at the YouTube headquarters. Therefore, they can't stop me. That's ridiculous. Of course, that person couldn't speak to me because that person does not exist. YouTube doesn't have physicians on their moderation team. Are you mad that they didn't give you a job or something? What's really going on here, Drew? And he ends it with, YouTube is free to stay on the wrong side of history. Their house, their rules. But it's time like these when I'm especially grateful that Elon Musk brought free speech back to the public square. You mean he brought back medical misinformation. Both Ask Dr. Drew episodes are still available on X, and I refuse to delete even 1 second of them to appease Google's unqualified, unlicensed, untrained, unidentified censors. It's weird to me that he thinks that they wouldn't have consulted with a trained doctor to find out what constitutes medical misinformation, or they wouldn't have talked to like the CDC, or like where does he get off thinking that it's just someone that like graduated high school sitting there deciding all the rules about the medical misinformation at YouTube? Like, have you done any research into how they've come up with these rules, or like Are you just upset that you don't have a job as their alleged qualified, licensed, trained, identified doctor of the moderators? Then he leaves the links to the broadcasts, and the broadcasts are still up on his Dr. Drew platform, which is drdrew.com. And the great thing about drdrew.com is that it is a community and advice site for teenagers. Yep. That's what it started as. And now it's basically just where Dr. Drew promotes his books, his radio and TV shows, and his podcast. Now you can go to drdrew.com and you can watch both episodes for yourself. Ain't that good news? I just thought it was funny that Dr. Drew was flipping out at YouTube for deleting his videos for medical misinformation and the way that he's arguing with them. So I wanted to share it with all of you today. YouTube does have a very strict policy on medical misinformation. And honestly, those of us that combat the anti-vax community really appreciate it. They hate it, but we like it. So according to YouTube, they do not allow content that possesses serious risk of egregious harm by spreading medical misinformation that contradicts local health authorities or the World Health Organization's guidance about specific health conditions and substances. So right off the bat, they're saying we are going along with medical professionals and what they consider to be medical misinformation. So obviously, Dr. Drew hasn't even read this. This policy includes the following categories: prevention misinformation and treatment misinformation. Note, YouTube's medical misinformation policies are subject to change in response to changes to guidance from health authorities or WHO, which is the World Health Organization. Once again, obviously, YouTube is working alongside the World Health Organization. So what does Dr. Drew mean when he says, oh, they're not listening to anyone who's a medical licensed doctor? Like, really? There may be a delay between new local health authorities and then the World Health Organization's guidance and policy updates. And our policies may not cover all of their guidance related to specific health conditions and substances. In other words, they do their best to keep up with them. Then it says what this policy means for you. Don't post content on YouTube if it includes any of the following. Prevention misinformation. We do not allow content that promotes information that contradicts health authority guidance on the prevention or transmission of specific health conditions, or on the safety, efficacy, or ingredients of currently approved and administered vaccines. You could argue that's the one that he broke. Treatment misinformation. We do not allow content that promotes information that contradicts health authority guidance on treatments for specific health conditions, including promotion of specific harmful substances or practices that have not been approved by local health authorities or the World Health Organization as safe or effective, or that have been confirmed to cause severe harm. Does these policies apply to videos, video descriptions, comments, live streams, and any other YouTube product or feature? Keep in mind that this isn't a complete list. Please note these policies also apply to external links in your content. This can include clickable URLs, verbally directing users to other sites in video, as well as other forms. So they do provide examples, and just for this video, since it was vaccine misinformation, it states, claims that contradict health authority and World Health Organization guidance on safety, efficiency, and ingredients of currently administered and approved vaccines. Vaccine safety. Content alleging that vaccines cause chronic side effects such as cancer or paralysis outside of rare side effects that are recognized by health authorities. Again, you could say That one was broken by this Dr. Kelly person. Examples: claims that the MMR vaccine causes autism, claims that vaccines are part of a depopulation agenda, claims that the HPV vaccine causes chronic side effects such as paralysis, claims that an approved vaccine will cause death, infertility, miscarriage, autism, or contraction of other infectious diseases. All Dr. Drew. Dr. Drew broke that one. Claims that achieving herd immunity through natural infection is safer than vaccinating the population. So you can see how Dr. Drew has broken that. It also says content claiming that vaccines have no impact on the prevention of disease, which again, Dr. Drew broke. Examples: claims that vaccines do not reduce risk of contracting illness, or claims that vaccines do not reduce the severity of illness, including hospitalization or death. Goes on to say content misrepresenting the ingredients contained in vaccines. For example, claims that vaccines contain substances that are not on the vaccine ingredient list, such as biological matter from fetuses or animal byproducts. Claims that vaccines contain substances or devices meant to track or identify those who have received them. Claims that vaccines alter a person's genetic makeup, and claims that vaccines will make people who receive them magnetic. The fact that YouTube even had to put that one on there, well, that explains everything, doesn't it? It goes on to leave additional resources, which of course lists like the CDC, the National Health Service in the UK, the World Health Organization, of course, UNICEF, etc. So like, if you're confused on what you can say about the vaccines, Dr. Drew, you could always come and read this. It says, what happens if content violates this policy? Your content will be removed and they'll send you an email to let you know. If they can't verify that a link you post is safe, they may remove the link. It goes on to say that if it's your first time violating their community guidelines, you'll likely get a warning with no penalty to your channel. Dr. Drew stated this wasn't his first time, but for some reason he's still complaining that he got a warning, not a penalty. Should be, thanking his stars. If it's not, we may issue a strike against your channel. If you get 3 strikes within 90 days, your channel will be terminated. We may terminate your channel or account for repeated violations of the community guidelines or terms of service. We may also terminate your channel or account after a single case of severe abuse or when the channel is dedicated to a policy violation. So you might want to watch out, Dr. Drew, and you can learn more about that at that link. I'll leave links to this all down below. So as you can see, YouTube is correct. They outline exactly what medical misinformation is, and it was what Drew was spreading. You would think that as a doctor, you would be able to realize that, but as I said earlier, just because you're a doctor doesn't mean you're intelligent. Let me know your thoughts about all of this down below. I hope that you're having a fabulous day, and I'll see you all real soon with another one. I love all your faces. Bye. Mwah. And make sure that you get all your vaccines.
Queen of Karma.